I've nominated Dr. Jenny Steele for this award. She is a GP in Darlington and she works with us in our Darlington CCG as an executive GP lead on transformation. Now, Jenny is a real force for change. She's been working with us probably for the last 18 months. She used to be the leader of the GP Federation in the town. She's now working with us as commissioners to really change the shape of primary care and community services for our local people. She's in the process of putting in place a number of community hubs where we can wrap services around our local populations, GPs, social care, voluntary sector, people from the trust, all working together to really make those outcomes for patients something very different. And that's no mean feat to get GPs to work in a very, very different way. There's another initiative that I'd like to tell you about too. That's something called Healthy New Towns. We're very fortunate to be one of the pilots, one of a very few pilots in Darlington who are putting in place a Healthy New Town initiative. This is building new homes for people in a very sort of difficult and vulnerable environment, a very deprived environment. But it's making that place an environment where people can remain healthy and look after and self-support themselves. And Jenny is a great leader in terms of getting all of those services, health services, public health services, all to work together to try and deliver the best possible care for patients. This uses great technologies, so we're really pushing the boundaries in getting some very new and innovative ideas into practice. And Jenny's been absolutely marvellous in pushing that agenda forward. So what's Jenny like to work with? Well, she's a really highly respected GP in the town because she's worked in general practice, in commissioning. She works into the hospital and she works with all of her colleagues in the GP Federation. But she values not just clinical expertise and professionalism, but also what managers can bring to the table. And she's been great in bringing us both together to try and make some of these changes that we need to make. She's such a lively and energetic character. Sometimes we're all running a bit behind her, but somehow she manages to pull us all along and help us to really deliver what needs to be done for patients, because that's what she's really focused on. She's not afraid to face a challenge. She will absolutely get her sleeves rolled up and she wouldn't expect anybody to do something that she wasn't prepared to do herself. What I would say though is she has got very exacting and high standards and that can really be a challenge. But she's great to work with and I'm really pleased that she's been shortlisted for this.
I have nominated the Transformation and Organisation Development team from North Tees and Hartlepool Foundation Trust. This team is made up from clinical leads, project managers, organisation development practitioners, workforce and system experts. The team have developed a project management framework which supports every member across the trust that has never been implemented before. This is offering great opportunities for those who recently didn't have that support to give structure, monitoring risks, benefits and opportunities for every way along the project. This is supported by a newly developed filtering tool which allows the projects that come through the filter to be categorised and signposted into the right direction, understanding what our trust vision is and strategically how we need to filter that through. It is truly a multidisciplinary resource, which means the staff have readily available access to project management skills. The team has clinical expertise which allows them to have a real awareness of hospital environment, patient care and the day-to-day stresses of staff and in the environment within the hospital. This is why I have nominated the Transformation and Organisation Development team.